I came in because the veins would bulge on my lower leg and were very unattractive, and I had an ulceration which wouldn't heal. It started just healing right up. It just, the circulation improved, I guess. It just was gone. But my leg is just like brand new. I mean, it's just like so wonderful. Well, I would think that any woman that knew about this would sign up for it in a minute. So,
I'm a registered nurse, and I've worked with Dr. Byrne for many years. And they've been performing the procedure, the EVLT, and it's fairly new, and they've been really good success with other patients, and I'm really excited that I'm a candidate for it and able to have it done, because I've had swelling for at least 20 to 25 years and pain from the veins, and I just never had anything done about it, and I'm glad that I found it. You know, Dr. Byrne did ultrasound and found that I'm a candidate, and I'm really excited that I'm able to have it done, because it's been bothering me for a long time. You know, pain in the back of my legs and swelling and stuff. So it's really great. I'm really excited about it. Other patients that I've seen come in for the procedure have had no problems whatsoever. They are able to go right back to work, and they're very happy with their results. And I know I will be too. As far as going back to work, I plan to go back to work tomorrow. We have a really busy schedule, and it's not a problem going back to work right away. I just got to wear the hose for a few days, and it's not a problem. My mom actually had her veins stripped, and I did not want to have my veins stripped. I just thought that would be an awful procedure to have done. You're in the hospital, it's a lot of downtime, it's just, I get to go home. You know, as soon as the procedure's done, I've got to wear hose for a few days. What a big difference. I just don't want to sit home. Obviously, you would have to have the varicose veins. And they would do an ultrasound to verify whether you're a good candidate or not for the procedure, to see if the veins are incompetent or not. If you have swelling and pain, in most cases, insurance will cover it. So, which is really nice. So.
How you doing, Crystal?
Good, Dr. Berman.
You'll feel real comfortable during the procedure, and then it'll take about 35 minutes, and you'll be done.
Great. Oh, that's quick.
Good.
Thank you.
I'm going to prep you up here.
Great.
Going down.
What is that?
How you doing, Crystal?
Good.
And we can see the wire right in the vessel. And next we're going to go ahead and put the catheter over the wire. Okay, you're doing okay? So we've just put the sheath over the guide wire and removed the guide wire, and you'll actually see the sheath's right at the junction of the saphenous and femoral vein. And if I move it back and forth, you can see it approach that junction right there. So that's just perfect.
And the opening and closing of the valves.
You see the advancement of the catheter from the left side of the screen right to the valves. And you'll see it stops right there. I'll back it up just a little bit, and you'll see the leaflets fluttering. Crystal, please take a deep breath. And there's the opening and the closing of the valve. And we'll just keep that catheter tip right there. Next, we'll advance the fiber optic through the catheter.
Okay, I'm sorry.
We're going to do a test firing of the laser through the fiber optic. Heaney beam, please. Beautiful. Fiber optic's working well. Heaney off, please. And now we'll advance the fiber optic under. Next, you'll see the fiber optic advancing towards the end of the sheath, right to the junction. And it'll stop right about there. We're going to continue just providing some tumescent anesthesia all the way along the length of the vein. We're going to go ahead and fire the laser, and as we fire the laser, the fiber optic glows red, and we're going to retract that fiber optic back approximately 1 millimeter every second. And as we do, the incompetent saphenous varicose vein closes off along its length. And you'll see this red glow of the laser.
After the procedure was over, it was great. Got it right home. I took it easy for just a couple hours. Went back totally back to my normal activity, and the following day I went to work. So it was It was great. There's no waiting
I
whatsoever.
went home and I slept a little, and then I just resumed all my activities. I actually went into my office, which I didn't have any problems with anything. And the next day, I went out and did my regular workout. It was just fine. I did wear the stocking. And then the next day after that, I went to my yoga class and did all my regular yoga stuff. So, and never had a single thing that came up for me that was hampered me in any way. It's just hard to believe. I got the stocking thing was kind of interesting, but I even went hiking in Yosemite that weekend, I think. So it was like, wow, just really had a wonderful experience there. So.
My mom had her leg veins stripped like they did years ago and was in bed for a long time. I was so young, I don't remember, but it was at least a week she was in bed for, couldn't do anything. So it's really nice that you could just go back to your normal activity again. So it was fantastic having that done. For years I've had problems with my bulging leg veins, swelling, pain. It's been very uncomfortable. I've always wanted to do something about it. I'm very excited that I finally got it done. I don't have the problem anymore. The bulging's gone. I can't wait to do my other leg. It'll be great.